Good evening and welcome to this webinar sponsored by the MSU Spokesman. On behalf of the School of Global Journalism and Communication at Morgan State University, I'm Milton Kent, Professor of Practice here. I'd like to thank you all for joining us this evening. During its 79 years of existence, the MSU Spokesman, the news source of record for Morgan State, has reported on and examined the issues of the day as they've impacted the campus community and people of color in Baltimore. Over this past academic year, through a grant from the Poynter Institute's College Media Project, Spokesman reporters have taken a microscope to the matter of health inequities in the city and around Morgan under the umbrella of the title Black Health Matters. Tonight, the Spokesman has assembled a dynamic panel of medical and campus experts to discuss not only those health issues, but matters related to the reopening of Morgan this summer and fall, including the requirement that all students, faculty, administrators, and staff be vaccinated to access the campus. In a moment, we'll meet our moderator, who will present all the important questions, including yours. But first, some recognitions are in order. It's been my honor to serve as faculty advisor to the MSU Spokesman for the last 6 years. I'd be remiss if I didn't thank the founding dean of SGJC, Dwayne Wickham. Dean Wickham will be retiring after this academic year. His constant and consistent support has been crucial to any success the Spokesman has had. Additionally, thanks are in order to Jacqueline Jones, the Assistant Dean for Programs here at SGJC and the Chair of the Multimedia Journalism Department. Finally, we'd like to thank Barbara Allen, Poynter's Director of College Programming, and Wanbo Wu, who has advised us on this project during the past year. We also thank Tatiana Turner of the Baltimore Sun for her assistance. Now, on to the program. To lead this evening's discussion, our moderator, Oyin Adedoyin. For the last 2 years, Oyin has been the Spokesman's editor-in-chief, and during this past year, she's been the driving force behind Black Health Matters, editing and writing stories for the site. Please welcome Oyin.
Thank you, Professor Kent, for that introduction and for being a wonderful advisor on this project and for the Spokesman. I'm really happy to moderate this panel tonight of healthcare experts and leaders at Morgan State University, as well as locally and nationally. So first, I'm just going to start with some brief introductions of our panelists here today. In no particular order, we've got Dr. Kim Sydnor, who is the Dean at Morgan State School of Community Health and Policy at Morgan State University. And she currently researches program evaluation in 2 key areas, including child development and the Maryland courts. However, over the past year with the COVID-19 pandemic, the university president, David Wilson, has referred to her as one of the leading public health advisors on campus with the school's COVID-19 reopening plan. We've got Professor Dr. Celine Gounder, who is an infectious disease specialist and former COVID-19 advisor for the Biden-Harris administration. Dr. Gounder is the founder of Just Human Productions, which is a nonprofit multimedia organization. And she's also the host and producer of American Diagnosis, a podcast on health and social justice, as well as Epidemic, a podcast about the coronavirus pandemic. We've got Reverend Dr. Bernard Keels, who is the Dean of the University Chapel at Morgan State. Prior to that, he served as the executive director of the Methodist Action Program in Washington, Delaware. And he also previously served as district superintendent of the Baltimore West District of Baltimore, Washington's conference. And then we've got Dr. Risha Irvin from Johns Hopkins University, who is the assistant professor at Hopkins School of Medicine in the Division of Infectious Diseases, where she focuses on clinical care, research, community engagement, and other projects. Additionally, she's also been working with the COVID-19 Prevention Trials Network on community engagement, both locally and nationally. And she is the Associate Vice Chair for Diversity and Inclusion for the Department of Medicine at Hopkins. And lastly, but not least, we've got Dr. Kevin Banks with us, who is the Vice President of Student Life at Morgan State University. He is responsible for overseeing 9 units that support out-of-classroom learning opportunities for students at Morgan, and he's also been pivotal in those conversations regarding the fall reopening and campus reopening at Morgan State. Thank you, everyone, for being here today. Just going to open it up to everyone on the onset of this conversation and kind of start with, at least for you, what do you see coming next in the next couple of weeks as we look at COVID-19 restrictions for the vaccine going down to people 16 and over? What in your respective fields do the next 3 to 4 months look like? Dr. Gounder, you can go first.
Sure. I think we're already getting a lot of questions about what can I do if I've been vaccinated? And I think one major misconception here is that vaccination works best at the population level, not the individual level. And so just because you yourself have been vaccinated doesn't mean that life is 100% back to normal. And so this is why there are still some measures that you're going to see folks like me, Dr. Walensky, who's the director of the CDC, and so on, still recommending, because vaccination reduces your risk by, let's say the Pfizer vaccine by 95%. That's the vaccine effectiveness, but that's not 100%. And so if you're still exposed to a lot of virus in the community, and some communities unfortunately do have very high levels of transmission still, there are going to be recommendations that you still need to layer protections. But hopefully, as community transmission rates decline, then we'll be able to release, to stop wearing masks, to not have to do some of these things. But it's really dependent on bringing down the level of the virus in the community, in addition to getting everybody vaccinated. So, I think that's something I see in the next couple of months, is just really trying to make sure people understand the combination of needing to get vaccinated yourself, but also for your community to do so and to get control over the virus. I think the other big thing on my mind is half my family is in India, and seeing what's happening on the ground there right now has me frankly terrified. And this is the worst that we've seen during this pandemic. It's worse than what we saw in the US, worse than we've seen in places like Brazil, which has been hit extremely hard. And we don't quite know how this is going to unfold. Unfortunately, they simply do not have enough vaccine, and you cannot really vaccinate yourself out of a surge. You really do have to implement other measures like social distancing and masking and so on. And that's a place where it's really hard to do that because there's not much in the way of social supports to help people get through that. And they don't have enough vaccine for everybody. They only vaccinated about 9% of their population so far, and the vaccine supply is drying up. And so I'm very worried about countries like India, countries in Africa, other parts of Asia and Latin America that simply do not have the supply, and what that will mean for them.
So I'm going to follow up on Dr. Gounder, and my sympathy and prayers for the family and all the folks in India, because this is a pandemic, and it's not a localized issue for us. So definitely know that we're with you in heart and spirit, and the same thing we can do, just please let us know. But I do want to follow up and say the next 3 or 4 months in my mind, obviously is focused largely on Morgan, but the community beyond. And it is this messaging, clarity and messaging. CDC is relaxing some things. However, Baltimore City is in an uptick still. I think we're beginning to flatten out, but there's certain sectors of the state of Maryland who aren't equally as vaccinated, and where the virus is still having its way. So I think it's going to be very nuanced messaging we need to be clear about as we talk to students and surrounding community about how it's going to work for us. And I really appreciate what Dr. Gounder had to say around it's a collective issue. Individuals make choices, but they have large collective impact. And we have to make sure that we keep those issues at the forefront. And it's a hard message to make in the midst of graduation, right? So it's commencement celebration. CDC says it's time that we can relax some. People hear that message. The vaccine is out. People hear that message. Everybody's eligible. They hear that message. They often don't listen to the cautionary tale at the other end of that message. So I think our work and on Morgan's campus, and my work in particular in our school, is going to be to help reinforce that message, to help clarify that message. And the other piece is, I know we'll probably get to it, is to have a really good conversation around vaccination for those who have not yet made that choice. And so I'm sure that's going to be a question coming up, so I'll reserve that response, but I think that's the work ahead of us.
So I was just going to say, I think as we think about things, continuing our lens of looking at things through kind of COVID-19 health equity. And, one of the things as we transition now in this period, initially we saw, a lot of these big events where we were having mass vaccination events and kind of the bottleneck of people coming in. I think now what we're transitioning to is really thinking about how do you target communities and partner with them to make sure that everyone has access to the vaccine in a place that they trust, with people they trust, that they can ask questions of, that's close to them, and making sure, all of us are partnering together and getting into communities that still need access to the vaccine. And so those are a lot of the conversations that I know have been going on with the health systems, with the, local and kind of state government. I know with kind of Morgan's leadership and others have been thinking about that across kind of Baltimore City, and how we make sure we're targeting people correctly. And, this will probably come up later, but also just making sure that we have venues where people can get all of their questions answered, and that there's a difference between having vaccine hesitancy and being anti-vax, and that those are two different things, and that we can't characterize people for having questions, legitimate questions that they want answered about the vaccine.
Well, I'll jump in. That's a great segue for me. As you all know, we are going to be launching our community vaccine site this weekend, and so I'm glad that we'll be able to play a role in getting the vaccine into the communities. We believe people trust Morgan State. We've always been in the forefront with voting, right, and voting opportunities for folks. And so I think strategically, we thought this was in the best interest of the community to host the vaccine site. We did have a pop-up site for our students yesterday, and I'm glad that we had a significant turnout for students that showed up and minimal cancellations. And so, but again, the conversations around the hesitancy versus anti-vaxxing is on my, I have messages 3-4 a day, either email or phone calls. And so our vaccine management team is going to be circling the wagon to look at how we're going to address those concerns, because we really want to have a campus that's going to be able to have face-to-face instructions coming into the fall. We want to have people to be comfortable and living in our residential facilities and not worrying whether their roommate or suite mate or apartment mate is vaccinating or not. And so there's going to be some other key decisions that we'll have to make sure that we're protecting the cave, as we say here at Morgan State University.
And how about you, Reverend Keels? The CDC announced recently that churches can start opening at minimal capacity again as well. What are some of those conversations like going on with you? Oh, you're muted.
Yeah, he didn't.
Yeah, Reverend Keels, I think you're still on mute.
It's still muted.
Okay.
There you go.
Is it better? Thank you. My
There
apologies.
you
A group of pastors act now in the leadership of Reverend Dr. Al Hathaway of Union Baptist Church have been meeting regularly on Tuesdays to help churches understand how important it is, as we approach the normal getting back together in worship, that the church act as a catalyst for sharing information about vaccine sites. And I'm very proud to be part of that representation from Morgan, because it's imperative that we in the faith community realize the diverse needs of faith communities around town. Some are isolated, not very much connected with the network in the city. So this effort has been very, very helpful in communicating to people that there is a spiritual presence of help. The church is going outside of the confines of their own walls to reach their neighbors and to spread the word that is important, to be able to talk to one another. People are coming out of a time of being very isolated from one another, and now is the time for people to be able to share some of their concerns, even their fears about the pandemic, but more importantly, to realize that if we are going to be the church, we have to be the church in the fullest sense of the word. That means spreading our word and among the interfaith community, amongst the various neighborhoods and councilmatic districts in Baltimore. And I'm proud to represent Morgan's councilmatic district in that effort.
Thank you. You all touched on some really interesting points. I kind of want to lead with something that Dr. Gounder said, as far as internationally, seeing what's going on globally in places like Brazil and India. I know that one of Morgan's kind of main missions is this global perspective and to draw in students globally. Has there been talk, amongst Dr. Banks and Dr. Sydnor, have there been talks around how to navigate that?
We're definitely invested in international student population. We already have on Morgan's campus. We're connected with Morgan, a fairly good sized international set of students already. We are hearing from them, trying to do all we can to make sure that they stay connected in the way everyone else is connected. We are hearing the particular concerns, of course, when at one point when the ability to travel here obviously became a major issue. We've begun to see some of that relax, but that's just in the US. Obviously, that's going to remain an issue. We do have the Office of International Affairs. We're working with our students on the student side to make sure all those issues get addressed. But beyond that, I think we do have a global responsibility. Morgan is part of the consortium for universities in global health. So we have folks working with that unit to make sure that we're doing all we can to play our part and not just bringing students here, but being part of a global community so we can do our part. So we are sensitized to it, and we are hearing, listening to that. I think we can do a better job, but at least we're at the table in terms of the conversation.
Yeah, I would definitely agree. We are fielding communications from students abroad about, they may be on the AstraZeneca protocol. Will that vaccine be okay to come back to Morgan with? And so, those are the conversations we're having. If they don't, and what if they can't get the vaccine where they're at? Can they come here and perhaps be in a quarantine situation for several weeks, for 2 weeks, and then perhaps become vaccinated? And so those are the things we're going to explore to assist our international students.
Kind of transitioning into a reflective period for this, we want to go back and think, what have we learned in all of our respective fields from this? Because, nobody was prepared in any way, and now you're kind of flung in the forefront. What do you think in some cases could have been done differently? Let's start with you, Dr. Irvin.
I was going to say, so, a part of what you said at the beginning, it was kind of what we've learned. I think, everybody in this room probably already knew, but I think what may have become more clear to the general public is kind of this existence of health disparities in our country, and kind of the long history of systemic racism and issues that have led to health consequences, particularly in African-American and Latinx individuals and others. And so I think, COVID for many people was able to shine kind of a light on that for some people. I think what we all could have done is maybe had messaging better at the beginning in terms of kind of who was at risk. One of the things, that's come apparent out of the data, coming out of the CDC is that, many people were on the front lines, mostly Black and Brown people, who didn't have the option to stay at home when everything shut down because they were considered to be essential workers. Many of them were going to work and didn't have PPE. And so I think that's a failing of our system. And so one of the biggest lessons, and again, I think many of us knew this, is that there hasn't been investment in public health infrastructure in the United States. And so, we weren't prepared to hit this, running. And so what can we do now to build up so that if something like this happens again, we're ready, we have the resources, we have the people to go out and hit the ground running so that we can do a better job in servicing people.
And kind of on that topic, Dr. Irvin, I know you are an expert on infectious diseases. There was a lot of talk, especially early on, about things that we weren't prepared for. But what are some things, I guess, that you kind of knew or anticipated about COVID-19 that didn't really surprise you? And everybody else is also welcome to speak.
So I mean, it kind of tying back to that, like I wasn't surprised to see the data about how COVID had impacted the Black and Brown communities, and particularly looking at like our local data here. And so I think those were things that many of us weren't surprised about, and again, some of that's just related to the jobs that people have is related to kind of living condition, is related to redlining in Baltimore, and how multi-generational families live. And so one person was going out and being exposed and then exposing, the whole house, unfortunately. And so, I think many of us weren't necessarily surprised by that data. We were upset by it because something more needs to be done. But a lot of those things are systematic issues that, again, haven't been addressed in many years by folks. And so I think this sounded the alarm, not just on kind of health related to COVID, but overall that we've got to do more in terms of the health systems have to do more. We have to do more in terms of community partnerships. We have to do more in getting out in the community and educating people about things, and trying to, make kind of, this symposium's about kind of African-American health, and making those giving people the resources that they need, but tackling systemic racism, I think, is a big issue and how it's impacted health overall. And I do think one of the earlier comments about Morgan having vaccination clinics, I think things like that are so important. And I think HBCUs play such an important role. And I am a graduate of an HBCU. I went to Spelman, and so they hold a very special place in my heart. But I think it's very important in terms of trust in the community, and people often go to institutions that they trust, that they know have been in the struggle with them for years. And so I think it's really important for places like Morgan and other places to kind of be, in this work. And so happy to be here tonight and for, knowing about all the things that are going on in Morgan as well.
I'd like to jump in if you don't mind. One of the things that we've learned, and the significance of mental well-being, and it's unfortunate that it took a pandemic for this to come up, but we've got to normalize mental well-being, and we've always, some of our communities struggle with that going, paying to tell somebody, when you're struggling emotionally, mentally, and even spiritually. And so I think that we really have to just pay more attention. The messages that we send about taking care of oneself is got to be, it can't be crisis driven. It's got to be part of the DNA of our campus experience, particularly working with our health services, and even working with communications and students, because students really make a difference in this space. And I saw that with our health and safety ambassadors that we had on the campus, and in terms of talking to students about mask wearing and everything. So that's something that's definitely a big lesson learned.
I would add to that the faith community had a particularly good lesson to learn in terms of their ability to be trusted in the community, to spread information about the pandemic itself. I think at first there was a hesitancy because people didn't want to go outside of their own particular denomination. One of the things that I think has happened, there's been some very strong discussions among clergy persons to look at the need to be able to share with their population, because students attend a lot of the churches in Baltimore. And we found that the Morgan students are more informed than some of the churches were. So one of the things that I helped them do was to identify ways in which they could go within the neighborhood, and particularly those people who were living in out of reach neighborhoods who couldn't get to vaccination sites, et cetera, providing transportation, providing the spiritual counseling that was needed to make people feel assured that they would not be left in the margins of vaccinations, And so I think that was a really good learning dynamic that occurred in the Black community with churches, because they began to discover something that we began looking at 200 years ago. That was the church as a significant outreach center. And that outreach phenomenon has been reborn during this pandemic. And I'm really, really grateful for that.
Yeah, and I would add that for me, it's both the bane and blessing of COVID is that people now understand what public health is much better. Before you talk about public health and immediately somebody's talking about a clinic or fluoridated water, literally, like that's the only thing that you think about public health. I think people now get just how big public health is, how broad that network can be cast, how literally every single person is a part of the public health sort of workforce in all the things that they do. And I think that realization now brings it home that we can, moving forward, have these conversations so we all collectively own the responsibility of the public's health. It is a community responsibility. It is a citizenship responsibility. And so that's the lesson learned. I didn't realize how few understood it, even though even members in my own family still think I'm a psychologist. Keep telling them, no, that's not right. That's not what I do. But the fact that we can now have this conversation and we don't begin with what is public health, it's more like, let me learn more about public health. I'm excited about the possibility for building the future public health infrastructure, because I think more people, particularly students, now understand how they can be part of that. So that's a reflection on what we didn't know, I think what we are learning, and I think that's a lesson that will hold to good advantage moving into the future.
And to pick up on that thread, I think we've massively underinvested in public health for decades, really for the entire history of this nation. And I think part of that is because public health is the marriage between science and social justice. And that is simply not a space that we have prioritized up until now. I think the pandemic revealed some particular weaknesses with respect to public health, one of which is workforce. And the health commissioner in Baltimore, Leticia Duraza, actually has a really amazingly innovative program in collaboration with the Rockefeller Foundation, where they have hired up community health workers from the hardest hit, the zip codes that were hardest hit during COVID, by COVID. Many of these are women, largely women of color. Some of them lost their jobs, for example, doing as home healthcare workers and the like, also related to the pandemic. And I'm hopeful that they will be able to find ongoing funding to support that workforce. I think we simply do not have the bodies right now to do the public health work we need to be doing. Between 2008, 2009, and since, and that was the big recession, we lost some 50 to 60,000 public health workers across the country, and they were not replaced. And some have estimated that we, in fact, need something more like on the order of 250,000 additional public health workers to do the job, to really serve the communities that they need to be serving. You have some communities that will have just a single public health nurse who is supposed to address all of the public health needs of a community. And I think the other important piece here, and this is very much baked in, by the way, to the Biden clean energy plan, for example, which is people will support a program if it creates jobs in a community. And so if you're creating public health jobs, that's a really great way to get people on board with the public health measures you're talking about. The other two pieces of public health that clearly are very weak and that really do need investment are our labs, our laboratories, and our bioinformatics. So that's basically your tech systems. And I have seen some health departments, and I used to work at the New York City Health Department running their tuberculosis control program. I've seen some health departments that have DOS-based systems. Now, if you were born maybe in the 2000s and beyond, you may have no idea even what that is. But for those of us who remember the floppy disks in that era, it's sort of that era of computer technology. And so it's really difficult, for example, to ensure equity for COVID vaccine rollout when you can't even collect basic data, demographic data in an efficient way, when you can't offer appointments in an efficient and equitable way. because your computer systems are just not designed to do that. And so that's unacceptable that today we would still allow that to happen. And then I think the other point I just want to make in terms of learnings, and to me, as somebody who has worked in TB and HIV since the late 90s, who was an Ebola aid worker, and then now seeing what's happening with COVID, is you absolutely should not politicize a pandemic or an epidemic. It is the worst thing you can do for public health. And we saw this happen with Ebola. Some of you may remember that. The former president was tweeting at the time, we need to close down the borders. And people like me who were trying to go over as aid workers, we were worried, well, will I even be able to get back in the country when my couple months of service is done? That was really problematic, and it was highly stigmatizing what was being done at that time. And then on the ground in Guinea, where I was working in West Africa, they were in the middle of their own presidential election. And that was a real problem too, because then you had the different political parties using Ebola and the money that was available for Ebola health education in different communities was being used for political purposes instead. And I really appreciate what the Reverend said about faith communities. I think that is a nonpartisan community-based organization that many people trust. And what really worked for us in Guinea was pairing with imams and other faith leaders and educating the community in collaboration with them.
How would you? Oh, I'm so sorry, Reverend Keels. You can go ahead.
That's the key point that the doctor just mentioned, because one of the things about the combination of science and social justice is the church has been very familiar with social justice, but somehow afraid to be able to communicate in a very clear and precise manner the science of what's been going on. And what we found in the ACT group on Tuesdays is that an interfaith collection of clergy persons is a very good model, because it speaks to the totality of the faith communities, not just within the Christian community or the Islamic community or the Jewish community, but to be able to share that information and to be able to do it in a way in which we use our social justice model to understand how we communicate the science values to communities as well.
Yeah, I kind of wanted to shift gears a little bit to students and kind of talk about, I know Reverend Keels, you mentioned that you had some student involvement as well with the churches as far as spreading knowledge about COVID-19 and the vaccine. We had a spokesman videographer go around campus and kind of talk to some students who are working there or living on campus there and take some video. So we have a clip of kind of how they're feeling about vaccination and the fall reopening that we wanted to show before we transition into this next section.
How I feel about campus reopening, I feel great and confident that our administration has chosen the right thing to do. I'm excited for students to come back and actually get the campus culture that they deserve.
This semester has been pretty well. I've been a little stressed out because, the virtual learning and everything, but I am definitely still adjusting.
I'm not really sure how I feel. I'm excited, but I'm kind of reluctant a little bit because everybody hasn't gotten vaccinated. I am fully vaccinated. I actually got my second dose of the Pfizer shot yesterday. I got vaccinated because I have a compromised immune system, but whatever. I mean, the chemotherapy was man-made and it killed my tumor and I beat breast cancer. So, I mean, it was recommended, so why not take it? Because we miss the campus life, we miss the students, we miss being on campus, because we're a whole vibe.
I think it's pretty exciting to open the campus back up, and for this semester, I'm not gonna lie, campus and all the classes and stuff was a hassle for me, but I'm learning to push through and I have adjusted, so.
No, I have not gotten vaccinated yet, and the reason why is because one, I'm still doing more research on the vaccinations, on the 3 different ones, Johnson & Johnson, Moderna, and Pfizer, and I'm a little scared. So once I do more research and see how it can help me, and me being an African American, then I'll decide.
I have not gotten vaccinated, but if the university does require students to get vaccinated and push them to shove, I will have to get vaccinated. I have my own reasons on why I don't want to get vaccinated. We all know the history with the U.S. Health Administration and Black people That's also one of the reasons, and I also feel like the priorities of the U.S. is just all out of order.
If Morgan were to make students and employees get vaccinated before returning, I would understand both sides because, you know, vaccines are always an option to be opted out of because of religious reasons, but also a standpoint of, this point of this is a business at the end of the day, and school has to be in function and safety has to be taken into consideration.
The Johnson & Johnson vaccine definitely I just heard about it. So it definitely startled me a little bit in the regards of hearing people are passing away from it, people are getting blood clots from it, or whatever the case may be. I think that people want to get back to normality so quickly that they're rushing the process. And when you're dealing with health and when you're dealing with, somebody's livelihood, that process can't be rushed. It's got to run its course.
So after kind of looking at that video, what do you guys think?
I think we have work to do. I think I'm also encouraged that we will have students who will help us do that work on campus. So you heard an array of opinions and perceptions. Most students seem willing to listen. They want to learn more, know more. I heard some misinformation. We have to address that misinformation that goes out. But I'm happy to have and excited to have a conversation with our students and our community around what their issues and concerns are. One of the things that has been my pet peeve, I have to just say it, is how we talk about vaccine hesitancy and use it as almost a stigmatization. Well, if you're hesitant, you must be ignorant or something's wrong with you because you have not yet made the decision to vaccinate. And that's completely just not true. And I think we need to respect people's opinions who want to know more, have that conversation with them. And then what I always say to people is, we really hope you decide to get vaccinated. We want you to get vaccinated. I've been vaccinated, but you're going to have to make that decision. And we're going to do everything we can to make that decision really straightforward and simple for you. And then make sure you have access once that decision is made. So that's what I heard there, that we have work to do, work we probably could have done, to Dr. Irvin's point, much better in the beginning, because we could have anticipated all of this stuff. We saw it coming. We could have done a much better job of laying the groundwork for this conversation. So when we talk about requiring the vaccine, everybody would understand what that means. It's about our collective good. It's about protecting our community. And that we certainly would not put anything in front of folks that we did not think was safe and beneficial. And so I think that's what I got from that video, and always proud of the Morgan students who stepped forward in terms of leadership and their willingness to be part of this whole effort. So props to all of them. And it makes me excited about what can happen over the next couple of weeks.
Dr. Banks, you talked a little bit earlier about the walk-up clinic that opened up for students yesterday. We spoke to some of those students, and for the most part, it's kind of split. Some students are saying, okay, fantastic, Morgan is requiring this. I was going to plan on getting it anyway. Other students are saying, I'm still feeling a little bit on the fence about it, but since it's a requirement, I guess I have to get it. How many people did you see? Do you have a rough count of how many students showed up for that? And kind of what have those conversations been like with you?
Well, we had 115 students registered. We had 105 show up. So that was a good attendance. And so, and as I put the link in the chat, because we've been getting inquiries we have that was a Moderna clinic. So from now on, we're going to be administering Pfizer vaccine on the campus Friday, Saturday, and Sunday until the end of July. We will take a pause for commencement weekend, which is going to be a major event for us, and we're hoping that many of the folks that attended that have been vaccinated. Because we could ill afford to have some type of spreader event on our campus, and we're going to do everything we can to make sure people are safely social, as we say here at Morgan, and following the guidelines that we have. But we're in this environment now where they say you don't have to wear a mask outside, and I got to be honest, that's a concern for me. And so, but I think as a university that's hosting an event, we do reserve the right to set the rules for that event. So we'll stand strong in that space. Students, you know, again, I've been getting emails from students and phone calls from parents about first of all, is it going to be mandatory if you live in the resident hall to be vaccinated? And my answer is yes. And so, because there's students that are saying, you know, and family, I want to make sure that if my student is living on campus, that everybody is in their apartment or their roommate is vaccinated. And to me, that makes sense. I just know when we went to open last fall, the whole question was around testing. You know, it was like, hey, we got to make sure everybody's negative. I said, okay, we had a process in place to do that. But again, as we went through the fall semester, we saw how students got lax with going to make sure they tested twice a week. And so we'll be looking at how we incentivize making sure that people are compliant, but we need students to work with us to make the campus safe. And I know, I mean, ultimately, that's why we're having forums like this. And I appreciate the leadership of the spokesman in this space.
And talking about vaccines, you know, Moderna, Pfizer, Johnson & Johnson, I think something that a student mentioned in that video was just kind of like the difference between the three. Can any of you on the panel illuminate kind of what goes into deciding whether or not we want Moderna or Pfizer? I know in a story that came out in the Spokesman last week, the school was planning on going with Johnson & Johnson initially before the news came out about that, or maybe that was a consideration since it's a one-shot dose. Can you kind of illuminate some of that?
I will. And to be honest, the Johnson & Johnson was being talked about because we were getting towards the end of the semester, and the thinking was the one-shot dose, you know, they'd be able to go home. And when they get home, they're vaccinated. But as you know, things changed. And so we quickly changed and went with the Moderna vaccine for our clinic. And when we were negotiating the partnership with the Equity Task Force in the Maryland Department of Health, the Pfizer vaccine was always the vaccine that they were going to administer on Friday, Saturday, and Sunday. So, but I will tell you, as you all probably heard when they said that the Johnson & Johnson vaccine became approved, everyone was excited because it was a one-dose vaccine. Come on now, y'all remember this? Because I remember saying, well, I'm getting Johnson & Johnson too. But it didn't roll out fast enough. And so I took advantage of the Pfizer vaccine. And so, but you know, we've got to really, as I think it was Dr. Fauci said, the best vaccine is the vaccine you can get in your arm. And so there you go.
Yeah, I mean, Dr. Irvin and Dr. Gounder, I could speak, but since you all are MDs, I really want to make sure we hear from you. Please talk about Johnson & Johnson and clear up.
Yeah, I can jump in on that one. For sure. So the Johnson & Johnson, the side effects that we saw are these very, very rare blood clots. We saw a total of 15 among 4 million women. None of these that were reported to the CDC's vaccine adverse events reporting system, what we call VAERS, none of the cases that were reported to VAERS involved men. It was only women. And 13 of the 15 were in younger women, so women under age 50. Even then, even in that group, the risk of getting one of these blood clots is 0.0007%. You are more likely to get struck by lightning to have one of these than to have one of these blood clots. So even as a woman who's under the age of 50. And so I think you really have to weigh the risk. If you get COVID, if you end up hospitalized with COVID, your risk of a blood clot is 1 in 5, 20%. So that is a much, much higher risk of getting a blood clot if that's what you're worried about. You're much better off getting vaccinated, even with the J&J vaccine. And the J&J vaccine is a wonderful vaccine. It's highly effective. As you said, it's a one-dose vaccine. And so if that makes more sense for you to go with a one-dose vaccine, you should absolutely not be deterred by that pause. I think the pause was really important because if you look at what people were talking about earlier with vaccine hesitancy, I prefer the term vaccine confidence. It's more of a spectrum. We have some people who have more confidence or less confidence in the vaccine. A lot of what you see now are people who either A, do not trust the health system, or B, just don't trust government. And so it was really important that the FDA and the CDC take this seriously to show, look, we are trustworthy. We're going to show you, you can trust us by putting a pause, reviewing the data, debating this openly and publicly. Their most recent meeting was a 6-hour-long meeting that you could watch, was open to the public to watch online to participate in that meeting. They even had an open Q&A for the public at the end. And so they've really tried to be as transparent as possible so that people understand that the vaccines are safe and effective when they give that mark of approval. Dr. Irvin, do you have anything else to add?
No, I mean, I think that hits all of it. I just think, just kind of echoing what you said, I think the pause was important to reinforce that the checks and balances are there. And so now I think it's on all of us to make sure the messaging is right as we go out in the community and talk to them, talk to everyone about the vaccines now and how we message that.
Thank you. And I know, Dr. Irvin, you have to go a little bit early. So yes, please feel free to hop out whenever you need to, but really appreciate your contribution to this conversation. And I also want to take this time to say, if anybody has any questions, please use the Q&A function to type them in, and we will get to them in about 10 minutes or so towards the end of this conversation. So yeah, thank you. Just a reminder for everybody who's just checking in or has been here listening. And kind of going on to this whole idea of vaccine confidence, do you guys feel as if the FDA's kind of, early approach to this saying, okay, we're wearing masks, okay, we're not wearing masks, okay, you can wear masks, indoors, but you don't have to outdoors. Do you think this messaging is confusing the public? We talked a little bit earlier about kind of the effectiveness of communication. How do you think moving forward, there can be just like a more streamlined, I guess, communication method as we navigate the pandemic?
I think we did a not good job. I think we did a not good job. And I think we failed to use common sense in some regard in messaging. I think we were overly careful in not talking about giving people some fundamental tools to make decisions. Because when it comes down to it, everybody runs in their head this kind of cost benefit risk analysis. And they make decisions on their own individual behavior and trying to nuance. It's like, if you're feeling uncomfortable, the virus is present in abundance. You want to protect yourself. How do you best protect yourself? Here are your tools of protection. At the end of the day, you're going to make your decisions for yourself. We saw what happened. Some folks put masks on religiously and will never take them off. Like my sister, she'll probably be living with the mask for all the rest of her life. And that some people who never put on the mask and they put themselves and others at risk, but it was their decision. I don't think we trusted the public enough. And I think back again to Dr. Gounder and Dr. Irvin's point, if we had a public health infrastructure where trust and communication were established, it would have made a much better platform and foundation. But here we are trying to give novel information around a novel virus in a novel environment. It was just like the perfect storm for not good communication. But I think we're learning and we're going to do much better. But certainly from, Dr. Banks, Reverend Keels, everybody else's perspective, I'd be interested to hear how in each of your domains you saw that. But from a public health perspective, as a practitioner on the social behavioral side, I thought we did a terrible job.
Your sister may be onto something though. If you look at the rates of cold viruses, cough and cold people had this winter, or the flu, we crushed the flu this winter. So there are some other benefits. It's not just about COVID. I completely agree with what you just said. And I think I'll keep my comment brief here. The reality is we just did not have enough masks for everybody. And so the messaging should have been clearer to say, we don't have enough masks for our healthcare workers. We need to save the masks we have for them. And you should be making a cloth mask with what you have available to you at home. That would have been the honest message. And instead, the message was garbled and it was, well, you don't really need a mask. And it was really not honest with the public. And unfortunately, that really confused the public.
And I will say, I do think now, the Biden administration is trying to let science guide what the recommendations are, and recognize the value that we are getting from vaccinations. And so that people who have gotten vaccinated, there's some value in that. But it's hard because, again, it's a new virus, things change, we learn more, you issue new guidance. And so you have to continually update that. And I think the other piece that we've seen in terms of trying to make sure, for instance, the health systems, the city health department, the state health department, that we're all on the same kind of messaging as well when we go out and kind of talk about these things as well. And reflecting, what we've learned nationally, but also making sure our messaging, is cohesive here in our local community too.
Kind of on the topic of, vaccination and just COVID messaging, there's been a lot of debate as well on this whole idea of whether or not, schools should mandate COVID-19 vaccinations. We've seen Florida private schools, the recent news this week, kind of banning teachers from getting the COVID-19 vaccine. And we know recently Morgan just announced that the COVID-19 vaccine, along with, dozens of other colleges across the country, is going to be a mandate. What do you guys kind of think about this debate, this break?
The history of vaccination mandates, at least in this country, goes back to the late 1800s with smallpox. And there's a Supreme Court decision that was made in 1905, Jacobson versus Massachusetts, in which a man sued the state of Massachusetts saying he did not want to get vaccinated. And it's very clear that Supreme Court decision has been upheld over and over the last century, that in a situation where there is a public health crisis, the government has the authority to mandate vaccination, as long as that is the least restrictive option available in terms of preventing transmission. And I think with COVID, there are some alternatives. You could say to somebody, well, if you're not going to get vaccinated, you could get tested every couple days. And as long as you are compliant with that, that would be a reasonable alternative. So I think there are some places where you might see something like that. With influenza vaccination, New York State, for example, mandates that all healthcare workers get a flu vaccine every year. They can opt out if they are willing to wear a mask for the entirety of flu season while on the job. So again, that provides an exemption and an exception and a reasonable way to still mitigate risk in these environments. And just one brief comment about that school in Florida. That's a private school, and it is a school that really is all about being anti-vaccination. That's really the MO of the school. So it's not surprising that they are doing this and also spreading misinformation about the vaccine. Part of what they have said is that if their faculty, their staff gets vaccinated, they will shed virus and infect other people. That is completely incorrect. The only way you can infect other people is if you get COVID yourself, the disease, not the vaccination. And that's how you shed virus. The best way to prevent that from happening is to get vaccinated.
Any additional comments before we go to questions?
Yeah, so I see a lot of silence, and there's a reason for that. I think it
Well, I was
is.
going to say something. I mean,
Like,
I don't,
good, Dr. Banks. That's good.
yeah. Well, and again, I have a residential complex of almost 2,800 students, capacity for 2,800 students, and I do believe that in order for me to afford students this opportunity to come back and take face-to-face classes, that students have to be vaccinated. I'm a strong believer. I have some health conditions that concern me, and as your vice president for student affairs, I'm always out and about now, and I want to be able to give the elbow bumps and those types of things, and I want to be confident that I'm interacting with people who are taking the same precautions that I'm taking, and I think that any parent, any student who wants that experience should make the sacrifice to make sure that they're going to keep themselves safe as well as others. And I do believe, because everybody wants to get back, but there's a sacrifice with getting back. Don't ask me about homecoming if you're not willing to do what you have to do to be able to come home and experience homecoming and be a part of the pageantry. And you just harken back to 2019. If you were here, homecoming 2019, we had over 20,000 people on this campus. 20,000, okay, came back. And I can tell you, we wouldn't be, without folks being vaccinated and being committed and possibly wearing masks too, we wouldn't be able to host an event like homecoming. And so we're going to have to figure out guidelines as to who will be able to come to homecoming, just like we're trying to work through getting ready for commencement right now.
And let me just add, Oyin, that this is not a decision that the university leadership came to easily, so I hope students understand that there's a lot of thinking that's going into this, the decision to require the vaccination, and that there will be more thought and discussion going forward. President is convening this vaccination task force to make sure that the way we implement the mandated vaccination does have a sense of fairness to it as best we can, does take into account people's need for exceptions, and obviously medical, religious, those kind of exceptions that are usually present with any mandatory vaccination policy are on the table, but that we also think this through for Morgan, right? We need to think this through for what this looks like at Morgan and the implications. And so leadership is going to continue to work that out, give students an opportunity to have input here and hear from you all so that we can get it as right as we can. But it is about a public and collective good. And just also think about the community surrounding Morgan. We're bringing all these folks back. We are not isolated. We don't live in a bubble. So all the communities surrounding Morgan that we're going to interface with, we have to think about them too. We have a public accountability outside our walls to consider. And so all these things I think are on the table, and we're going to want to hear from y'all to help us make sure we get it right.
Do you have any plans, and if anyone is open to answer this, to kind of engage students? I know with online learning and just social distancing, it's been a lot more difficult to have these kind of big forums and public gatherings to engage interest and see what the students think. What are your plans kind of moving forward in the coming months to do that?
Well, I'll start off by saying that we have really engaged our student leadership between Graduate Student Council and our SGA student government leaders. They've been involved in every conversation around reopening the campus. And as we plan for the fall, we have a 43-member committee, resocialization and reacculturation committee that has probably about 10 students on it, several alumni, faculty, students, and staff. And again, the people want to come back. They're giving us feedback, but they want to make sure it's going to be safe. And the themes that I'm hearing is protecting the cave, okay, reuniting, protecting, and respecting. Family reunion theme is in there too, but again, it's with safety in mind, because we recognize that we're still in a pandemic. And so we want to make sure there's an education and awareness committee, and how are we making sure everyone's prepared? We have a mental health task force that's doing work, doing a needs assessment to see how people are feeling about coming back if folks weren't vaccinated, as well as even if they are vaccinated, or there's the people that don't want to get vaccinated, but I want to be in face-to-face classes. And how do we manage around that? And so the feedback is tremendous that we're getting. And like I said, we're touching the major aspects of the Morgan State University community. So I'm excited about it. And again, there's a recognition that we might have to change things and do a lot of things outdoors. utilize our stadium. We have a 14,000 seat facility, which, you know, depending on what the outdoor capacity is raised up to or lowered to, we could have events in that facility that could bring in people and create the community that we are and that we long to get back to, but it's going to be a slow pace. It's not going to be rush into it, you know? And so I'm excited about the ideas that folks, and we also going to have to continue to embrace the virtual platform, because we know that that does work, and you don't have to worry about trying to squeeze, you know, a lot of people in a room for a meeting. And so we've got to still embrace the virtual platform and use that as the other delivery system, which we've grown accustomed to in this last year.
Thank
You know, I
you.
would add that one of the things that is so important, as I told a student the other day, is to live by a very simple mantra: to seek the truth, find the truth, and then tell the truth.
All right.
Because I think information is power, and the misinformation is one of the things that frightens me the most. But I think the university has done a fantastic job in involving all stakeholders, faculty, staff, students in the discussion. And I'm very, very, very proud to be a part of that.
At this time, we're going to move on to some questions from the audience. Once again, I'd like to encourage everyone in the audience to pose their questions in the Q&A so that we can kind of have our panelists answer. So one of the first questions we've got is from Aja Sid. So she's wondering, you know, with everything that's going on, with all these lessons that we've learned, how do we move forward as individuals? Particularly, how can we contribute effectively as students? So this is open to everyone.
You know, I hate silence. I don't know why, but it's a classroom thing. It's like a knee-jerk reaction to being in the classroom. So I think the students have already been really, really active. One of the ways is to be vocal and to be informed. I'm just going to echo what Reverend Keels just said. Seek it. What'd you say, Reverend? Seek it, find it, and deliver it. Whatever that combination was. It is a well-informed students are probably our best asset all the way around. To be informed around this topic, to be ambassadors around these issues. You don't have to become public health practitioners, but you can become part of the public health outreach workforce just by arming yourself with the necessary knowledge to protect yourself, protect your network with your information. That's one of the critical things. I think to become invested in all the systems and components that construct our public health. Leadership is critical. I mean, I think we've seen in this space that it matters who is in leadership and who makes decisions. So students should see themselves as leaders in this space, having their voices heard, being present. In some ways, I think I'm talking to the choir at Morgan, because these are some of the most leadership-driven group of students I've seen. But I hope that extends to everybody, even beyond student government, beyond SGA, that all of Morgan students can become informed, become ambassadors, become leaders, and put their voice out in this space. And because we are in this inequity space, for sure, our students have a role to play in being leaders in the social justice movement that's connected with public health, and figuring out how our international, you know, again, back to Dr. Gounder, a number of international students, we certainly can support the international community with our students and reaching out to our brothers and sisters in other spaces who could use the benefit of whatever resources and knowledge that we have as well. So I think there are lots of things students can do moving forward, and looking forward to being able to work with them. I think everybody on this call would be looking forward to working with our students moving into the future.
I definitely agree. I mean, when I look at over this past year, I saw our nursing students step up and go into the community. Before the vaccinations were out, they were into the community. And then they were doing the COVID testing for us over at apartment complex, Morgan View apartment complex. So, you know, I had a group of students that, we had a group of students that were doing, every 3 weeks, they were doing food shop days for the Food Resource Center to make sure that students who were having food, had any type of food insecurity, did not go hungry. So the leadership is here, and we know that given the right precautions, you know, we were able to make sure those students were safe in those spaces. And so the vaccine is just another layer. I mean, you know, if students come back with and they're vaccinated and they're wearing the mask and they're being socially distanced, safely social, as we call it, you know, I think we'll be fine. I think we will be fine.
So on to the next question. This one's from Brown Taylor. If you develop symptoms after receiving the vaccine, are you contagious? So there was a lot of confusion once the age limit was dropped down to 16 plus, at least here in Maryland, about what now, you know, like what can we do and what can't we do? And we see this week that that's still kind of being worked out with public health experts. But what do you know? What can we do?
I can speak to that. So you are not being given the virus when you are being vaccinated. You are being given a tiny piece of code, really a recipe for how to make the spike protein, which is those little projections on the surface of the virus. And so your cells are being given that recipe. They're making those tiny little bits. But it would be like, you know, I'm giving you my hand, but I'm not giving you my entire body. You're not being given the virus. So you're not able to have viral replication in your body. You're not able to spread a virus because you just don't have the virus in you. So, you know, and that applies to the Pfizer vaccine, the Moderna vaccine, and the Johnson & Johnson vaccine. In all three cases, your cells are being given the recipe for a single protein of the virus. You're not being given virus. In terms of what can you do after you've been vaccinated, this does depend on how much virus transmission is still happening in your community and what proportion of people have been vaccinated. And so this goes back to what I was saying at the beginning. Vaccination works best at a population level, not necessarily at the individual level. And so if you are in a community where very few people are vaccinated, where there's still a lot of virus being spread, even if you've been vaccinated, you are still at some risk. Remember, these vaccines are very good, but they're not perfect. So if you have a vaccine that's 95% effective, that means it's going to fail 5% of the time. And it's going to be more likely to fail if you're surrounded by people who are not vaccinated, who may have the virus themselves. So it's really, and this is why, you know, the CDC is having to navigate some of this, and why the CDC may say one thing, and then the states, or Oregon State, for example, might do something slightly different, perhaps more conservative, because they will have to tailor recommendations based on how much virus is in their community and how many people are vaccinated there. I think the final thing I would say on that is the best way to get back to normal life, to be able to do all the things that you want to do, are, for now, get vaccinated, wear a mask, and once the level of virus in your community comes down enough, and you can help contribute to that by encouraging others to get vaccinated and, at least for now, wear a mask. Once the virus levels come down enough, then we can all go back to normal.
I think, Dr. Gounder, the question was also about, what if you get infected after having been vaccinated? So there's some people after first shot, and then of course the breakthrough cases. I think that's what Oyin was referring to.
Got it. So, you know, after your first shot, the vaccines, and this is with reference to Pfizer and Moderna, because those are the 2-shot vaccines. This is different from Johnson & Johnson, which is just a single shot. Pfizer and Moderna have been shown to be about 80% effective if you wait 2 weeks after that first dose. The immune system doesn't respond right away. It takes about 2 weeks for your immune system to see the vaccine, to make an immune response. And even then, it's only 80% effective 2 weeks after the first dose. That means there's a 20% chance, if you're exposed to the virus, you could still get sick with COVID. And that's why we're seeing breakthrough cases. Even if you have 2 doses, the effectiveness is 95%. But if you're around enough people who have virus, there's still that 5% chance you could have a breakthrough case. We think that kind of disease you have, the severity of the disease you have, if you're one of those breakthrough cases, is less severe. But it's still, not a chance I would want to take. And that's why, at least so long as there's a lot of virus in your community, that we're recommending doubling up your protection with the vaccine plus a mask in the interim. And that's not forever. That's not forever, just to be clear. That's just until we get the virus levels down low enough in the community.
Right. And I think just adding that, and you can spread. So you can be vaccinated, but if you get COVID, you're infectious and you can spread. So I think that's the other. It's not like vaccinated magically, I have COVID, but somehow I'm in a bubble. No, if you get COVID, you have COVID and behave accordingly.
Mm-hmm.
And then there was a follow-up question to that that Vice President Kevin Banks answered, but just for the public, how is the university ensuring the safety of attendees for graduation and not allowing the event to become a super spreader? Will graduates be spaced out? Will there be sanitizing stations, temperature checks? What is kind of the protocol?
Well, I did write in the chat, I answered that question. First and foremost, the graduates will be spaced out, and attendees, we're limiting the guest tickets to only 2. And those guests will be sitting in the, together in designated spaces in our stadium. Our stadium seats 14,000. We have been given up to 25% occupancy, and so we should not even come close to get to touching that with the 3 ceremonies. Well, 25% of 14,000, how much? Come on, help me out.
3,500.
3,500. So then we
and
have,
I think we're 2,500 estimates are for graduation, Dr. Banks. I think they're estimating with guests and students.
Yeah.
So we're below our threshold.
Yes, we are. Okay, you already did the math on me. You already did it, Dean Sydnor. Yeah, so we should be fine with our 3 ceremonies. Unfortunately, we can't have as many guests as the students would like, and that's a tough, that's a tough decision that they have to make. But it will be live streamed, and I believe as a gift, they are providing all the graduates with hand sanitizers. I know we did talk about that. As you know, we sent out masks to all of ours. We sent out 2 masks to all Morgan students with a couple of bottles of hand sanitizer. That should be all used up by now, as I understand that. But and there will be probably hand sanitizer stations along the campus, because we have been installing those now. And so, as a matter of fact, they were out there yesterday, and so we're getting ready. We're getting ready.
And following up on that, you mentioned earlier homecoming and football games and all the things that people love, about coming to college. Are you seeing, to what extent are we going to kind of return to that kind of behavior in the fall? Obviously, it's impossible to predict, but what are you all kind of preparing for?
Well, I got a feeling we're going to have a real reservation system on steroids, for lack of a better word, because the reality of it is we're not going to be able to fill the stadium up to capacity, and I don't see that happening at all during this first fall season. So it would probably stay at if it's at 25%, and then we'll have to reserve X amount of seats for students to make sure that students get an opportunity to attend. And we haven't made a decision whether we're going to allow outside guests to come to the campus yet, and so those are decisions we're going to be making to provide guidelines. We do recognize that we interact as a university, we interact with other agencies in this city. We're partners with many agencies in the city, and so we'll have to make decisions to make sure that we are keeping everyone safe. And so yes, there will be a football game, and who knows? We started off. A lot of schools started off thinking they were going to play a game, and then COVID strikes, and you got to cancel those games, and that's going to be with us along the way. And hopefully, as more people get vaccinated, we'll see that those episodes diminish. And so, but we will, this year, this spring, we had a couple of movie nights whereby you had to do reservations and you actually had to be compliant with your testing protocol to attend those movies. And so, we got to figure out what our testing frequency is going to be in the fall, but, compliance is going to play a role in whatever privileges students are able to receive to participate in the festivities that we're going to have on the campus in the fall.
Yeah, and Oyin, I just want to add that it is every case will be evaluated based on conditions, right? So it's understanding the current conditions, what's in place by the state, the CDC, local health department, and then the on-campus Morgan environment and community. So always those factors will be on the table when evaluating what can and cannot be done on campus. So I need all the students, everybody who's listening, to understand that always public health is at the table in these conversations, not just our internal public health, but we're also conferring with Dr. Nguyen, our former Baltimore City Health Commissioner. Now we've got even more friends, right, to help us and give input. So the president has always put public health on the table, has always allowed us to be in the room as we are part of the decision-making around what's in the best interest of the student. And the president's always thinking about the both end. What can we do safely to kind of support what our students want and need? And so there probably will be opportunities, but just know that that decision tree will be on the table for each and every event.
Yeah.
You also mentioned earlier, one of the panelists mentioned that, the whole idea of Zoom, I think it was Dr. Banks, the whole idea of Zoom and kind of this hybrid online learning method is not going away. So what is that going to look like for next semester? I know we've been talking, generally in the workforce, offices are considering doing kind of 2 to 3 days a week. You come into the office and the other 2, you're not in the office and you're doing the online work. Have there been conversations about that for students or for students who feel, unsafe, or even teachers who feel unsafe teaching in person? What has that kind of been like?
Well, I will say that the goal is to try to have every class prepared to be able to pivot for a remote environment, or at least provide an option. Because think about it, even though we're going to have students and faculty and staff that are vaccinated, they can still contract the virus, but they won't. So we don't want them coming to class. We don't want them, coming to the campus. We don't want them leaving their room. So we've got to have an alternative for their instructional piece. And so ideally, every class that we offer, some limitations, will have some type of way to be we call it hybrid, in remote instruction. I think the term is high flex model of instruction, whereby we have the ability for the faculty to be in a room with students, and then there may be students who can't be there because students people get sick, and then if it's the faculty member could possibly teach from home, and you don't lose a class opportunity. And so those are the things that we are fine tuning, and thank goodness we've equipped over 1/3 of our academic classrooms to already be able to offer that mode of instructions, and that work is going to continue over the summer. And so that's the way we're moving forward, and we're trying to position the university to be able to sustain the learning environment for our students, faculty, and staff.
Right. So I think you heard from the president, the high flexes, and from the provost, the high flex is the way that we are moving forward, as Dr. Banks has described. Been a major investment in technology. I know some of the students are saying, well, what about the tech? That classrooms are being equipped with the technology to make that possible. And so I think we're going to be highly effective in the fall, being able to meet that, having face-to-face, because obviously folks want to come back to campus, having face-to-face, but understanding there's still need for remote access to courses as they sort of live stream through a Zoom platform. But there are going to be more details coming out and looking for individual classes to kind of respond to exactly what that looks like. And the university is going to be working on a standardized guidelines so students can be very clear about what to expect, but look for that high flex distance learning opportunity to still be on the table for the fall.
And one of my final questions for everyone is just how have your personal roles, whether it's the dean of the School of Community Health or your vice president of student affairs, how have your personal roles changed in the scope of the pandemic? At least for me, I know I had to kind of become something of a health reporter, and I was not very into science, in high school, which is why I chose journalism mainly because I loved writing. But yeah, so just in that respect, how have your respective obligations changed and shifted?
Oh. Where do I begin? I will say originally my functions changed to make sure that we were getting students home safely. So I was feeling like I was between mailing out what do you call it, laptops and other technology devices, because originally I was in that role as the vice president of student affairs. A lot of students know, hey, get in touch with me, I'll find the answer for you, and that's what we do in student affairs. We're like a catch-all. So in March, we were really around making sure that students had the technology needs that they needed, because we know that was a challenge for a lot of students being at home, and they went home for spring break, and then we said, well, you know what, don't come back. And so we had a lot of students who went home, had minimal technology at home with them or books, and which we told students to take things that they needed academically. But so we had to make a lot of different arrangements for students to eventually come back and get their belongings. And then we shifted to, okay, we're gonna have a small gathering of students that could come based upon extenuating circumstances. So then I became the extenuating circumstance gatekeeper. And so as well as how was testing going to go for students that came on campus. And so that was a big struggle for us, because I think we created an environment that was so alarming that students were literally, they were here, they were staying in their rooms, and they were scared. And I think we may have gone a little too far. So as we were having conversations with students, we're like, listen, it feels like we're in a prison here, And I'm like, okay, but people were scared, not knowing, and so I was the testing czar, well, not so much the czar because I had people working for me, but that was a lot of my function. And so if students didn't come for testing, people were contacting me, and so now it's sort of vaccine coordinator, I guess. I don't know. But you know what? I do it because I care about our community. I care about Morgan State University and our students, because I understand that they need to be in an environment that they can be successful in, and everyone can't do remote learning. And so, those have been things that really consume me. Getting this vaccine site up has been a heavy lift. I was a legal person a week ago, making sure that the lawyers dotted the I's and crossed the T's, but I do what I need to do to make sure at the end of the day we can deliver to our community. And it's been exciting, but it's been overwhelming and consuming. And so I have to figure out how to take care of me and be selfish too. And so, and that's something that we all have to learn how to do in terms of taking care of ourselves. I'll stop there. As you see, I can keep going.
Dr. Gounder, I want to make sure we give our guests, and then Reverend Keels, we've been talking, and I want to make sure we hear from you all too, because I'm interested to see from both you all's perspective what COVID has done to shift under your feet.
It has been a horrible year. I mean, honestly, a really, really hard year, between the work in the hospital and seeing patients sick and dying, the work that I do in public health, the work I do advising, whether it's some of our health officials and public officials here in New York or the Biden administration. I have been working 70 to 100 hours a week since February of last year, with 4 days off. So I am so excited for the day when I could say this is over. I can take a break, because it has been really grueling and exhausting. And yes, it's wonderful to be able to feel like you can have an impact, but it's also just really hard.
For me, I think it's really helped me focus on the importance of faith. Talking with students and staff who've lost loved ones and just being a good listener. It's been a very, very difficult year. There's also been a year when people have found a way to get more personal and interpersonal with their family, with their friends. And I remember one text very vividly of a person who was in my class a year ago who succumbed to COVID, and her sister called, and it was just a time of silence, and we embraced the silence. We also embraced the fact that her sister had made a great contribution to Morgan, a great contribution both as a staff person and as a student. And at the end of the day, I'm just grateful to be available, to be a vessel, and grateful for this opportunity as a spokesman to share in this panel discussion.
Yeah, and I'll just say, while I think it's been grueling for everybody in this space. It just, there's no way it's not been, but professionally, the chance to serve Morgan and the community through what I do as my profession has been a really rewarding experience. I was just happy that we could bring to bear the resources we had to be of service to Morgan and community. I think that's the thing that kept me going when everything got crazy. Always in the back of my mind was, but this is for a greater good. I can do this. I can push through this because there's a greater good on the table. And thank God, that's my personal frame of reference. Thank God that I had the tools, that we had the tools in this moment to be of service. So I have both, the burden of it, but the joy of it at the same time. And so I'm looking more at the big picture. I'm grateful. I'm grateful to still be here, grateful to have been able to serve, and grateful for the whole army of people all arrayed on this call and beyond, who've been able to step up in this moment, because this is what this moment has needed, and we've been there. So a personal thanks to everybody on the call, as part of the Public Health Network, for all the work that you collectively do to make people healthy.
Thank you. And thank you to all of our panelists for participating this evening, and setting your time aside. That kind of wraps it up for our session for the Black Health Matters Spring Town Hall. And yeah, that's all for me. Back to you, Professor Kent.
Thank you, Oyin. A few thoughts before we close. A recording of this webinar will be posted on both the Spokesman and Black Health Matters sites. And to the members of my class, a recording will be placed in the files folder in Canvas. Your assignment is due Tuesday. Thanks to our marvelous panel for their knowledge and their candor. We are indebted to Dean Sydnor, Dean Keels, Dr. Banks, Dr. Irvin, and Dr. Gounder. Please be sure and subscribe to Epidemic and American Diagnosis, Dr. Gounder's podcast, which are available in all the usual places. Next, a tip of the hat to the Spokesman staff. It would be difficult to put into words how special a group you are. From the editorial board to the writing staff, your commitment to quality journalism, particularly during these amazing times, has been extraordinary and very much appreciated. And finally, a word about our editor-in-chief, Oyin Adedoyin. Superb. Here's another. Magnificent. If it were possible to keep you for another year or 2 or 10, I would. But your status as an honor student and the need to share your prodigious talent with the rest of the world make that impossible. Suffice it to say, we won't see your likes around these parts anytime soon. The Spokesman and Black Health Matters will go on, but they won't be the same. Thank you for all you do. Thanks to our audience. We greatly appreciate your participation, and we invite you to continue to bookmark and read the MSUspokesman.com. Stay safe and have a good evening. So long, everyone.